All right, welcome to my e-portfolio for the end of the capstone course. So we're going to start out with the first concept map. So it goes over all the basics that we've learned throughout OT school. So frames of reference, we can open this up and you can see it goes into all of the frames of reference. So this is a great resource to have when studying for the MB-COP because there are just so many and it gives examples of each. So it's a really good review for all of them since there are so many to learn. Let's see, it really spans all the ones that we've learned this year. And then we have the OTPF broken down into all of its components. We have domains, portions of the evaluation, domain broken into areas of occupation, client factors, performance skills, performance patterns, and context and environment. The therapeutic process, including evaluation, intervention, and targeting outcomes, and then specific OT terms that we just need to know that are good to know. And then different kinds of reasoning, like clinical and critical reasoning from the therapy ed book that we had for this semester. So this is a really handy one to have because even though this seems like basic knowledge, it will all end up being on boards somewhere. So it's good to just have this handy. Then next is motor. So our first slide is assessing abilities and capacities in motor planning and performance. So it basically just goes into a bunch of different motor assessments that we've used in different components of motor performance, such as neurophysiological approaches, and then we break it down into different assessments that we've used, so muscle tone assessments, modified Ashworth, and then some examples, some great charts from our books, and also some YouTube links. And then over here we have the systems-based task-related approaches, which has more, just breaks down all the different assessments we've used, what kind of population you would use it for, how you do it, just the whole basis of it, which is also really helpful because although we've had a great assessments class, it's always good to just have like a nice little review of those so we know exactly what kind of patients we need to use those on when we're in fieldwork and when we're practicing. Evaluation is top down. Okay, and then our next one is more interventions based from Radomski. And so this concept map goes into different motor impairments, the theoretical paradigms, a really great chart of the Brunstrom stages for strokes, which is so applicable in so many situations. Different interventions, which are very important. I noticed that I didn't score very well in the interventions portion of the OTKE, so I will definitely be going back to this, especially because I would like to work in a population with stroke patients, or in a setting with lots of stroke patients, so good to know all of the different interventions that can be used. And then CIMT we've learned about a lot, and so this is just a really good overview of more CIMT stuff that we need to know for the test. All right, and this one is multiple factors that contribute to optimal motor performance. So we have this great chart with all of the different factors, and then you can open it up. We can get the mouse to move. So this just breaks down everything needed for motor performance into even more depth than we've seen in the other ones. So this is just really good, really in-depth info for us to study, which is really fantastic. And then more framework for OT interventions. Again, anything interventions related I think is really great for us to get to see, especially before fieldwork. This would even be good to just look at and be able to review some interventions that are commonly done for different diagnoses. So we have task-based interventions, different components that are needed to perform those interventions, the therapist's role, there's all of that, and then here we have interventions formed by multiple factors, so just remembering what all goes into choosing interventions for your clients. Where did that one go? intervention to improve postural alignment and balance. And so you have, say you want to work on standing balance, it gives you all these different things that you can consider when making an intervention plan for your client. And then same thing for functional mobility. You have all the different desired goals and then ways for your client to be able to achieve those goals, which is great. And then framework for occupational therapy interventions geared towards improving motor performance. So similar to the last one, we go up here. And so this one is very similar, looking at different aspects. And then, so this one goes more into like mechanical errors that can happen during certain activities. Then promoting capacity to generate contractions of specific muscles. So different, again, interventions that you could use for different goals that you're working towards with your client. So all really great examples. I will definitely be going back and reviewing these. And then more interventions, this time for limb apraxia. All right, and that is motor, and then we'll move on to cognition. So we have 3 maps here that cover different chapters. And so this first one is assessing abilities and capacities in cognition. So we have basic definitions over here in this section, and then we move on to the process of cognitive assessment. So how you would assess a patient for cognitive issues that they may be having. So a bunch of different assessments that you can use. And then over here we have the main, like the basis of cognitive status. So we have orientation, attention, just all the cognitive functions that make up cognition. Executive abilities, self-awareness, and then it just goes down, has some really good charts and just breaks it all down into the definitions that you need to know to be able to look for cognitive deficits in a patient. And then we have optimizing cognitive performance. So again, more cognition concepts that you need to know. Definition of cognitive rehabilitation. Then over here we have different approaches that you can use with clients, which I'm sure will be very helpful to know on the exam. So a bunch of different strategies, examples, which are really great, how they work. And then here, clinical reasoning in cognitive intervention, which is also very good to know. All right, and this last section for cognition is evaluation and treatment of limited occupational performance and cognitive dysfunction. So the intro of the chapter, and then models that are used. So this goes back to that first concept map where we talked about frames of reference and models. And these are specific ones to cognitive deficits. And then choosing the appropriate assessments for these patients. Managing their dysfunction so that they can work best with what they have. Then back up to the top, we have executive function as an impact on daily function, and this just goes into how specific cognitive deficits may affect their day-to-day life and their occupations that they're trying to perform. And then again with memory deficits, same thing, really great chart here. This is all really handy. Really great to just have everything in one place on this concept map so that when I'm thinking, ooh, I need to study cognition, this will be a great place to go for me. And then attentional deficits as well. All right, and next is sensation. So here's our first one, which is assessing abilities and capacities for sensation. So summary of the chapter, and then we go into the role of sensation in occupational function, the purpose of the sensory evaluation, neurophysiological foundations of tactile sensation, which is great. It includes some vocab, just basic stuff that sometimes you just forget. So good to go back and look over that because you would hate to miss something as easy as that on the MBCOT. Somatosensory deficit patterns, cortical injuries and what those include, spinal cord injuries. And then this is a nice little cheat sheet to different injuries. Very helpful. Sensory recovery, and then peripheral nerve injury, which is very common. And I'm actually doing a level 2 in hand therapy, so I will definitely be going back to this, not just for boards, but also for fieldwork as well, because I can't keep all of this in my head all the time, and I really need to get it down before I go to fieldwork, so I'll be reviewing this for sure. And then evaluation techniques, which are also very helpful, and we learned a lot of these in our evaluations class as well as with Dr. Hay in her class. Recording assessment results, interpreting and evaluating findings, and treatment planning. Treatment planning, again, an area where we could all use work. Choosing your evaluation methods, and then optimal assessment of sensation. The next chapter we have on sensory is interventions for occupational function. And so we have tons of different interventions that you can use for sensation. So kind of the basis behind choosing your intervention strategies, sensory re-education after peripheral nerve injury or repairs, therapeutic techniques, again, really helpful for interventions, compensation for impaired or absent protective sensation, which you could see a lot. I feel like you could see that in a bunch of different settings. Desensitization, interventions for occupational function, sensory re-education techniques, very helpful, especially since they're split up by phases. Some good examples of things. Compensation techniques. And then sensory treatment after a stroke, which will be seen a lot. Okay, and then we move on to occupation as therapy, and it breaks it down into gradation, analysis, and adaptation. So these are, again, basic concepts we know, but good to break it down into the nitty-gritty so that we really know it inside and out for the test. So it goes into occupation as a means and as an end, this thing that we've heard so much in OT school. So it goes into it as an end, and then as a means goes, and then kind of tying this into a bunch of different areas. So we have sensation here, movement, coordination, dexterity, range of motion, strengthening, edema, perceptual impairments, attention, memory. So this kind of goes into cognition, motor, sensory, visual, kind of covers all your bases. And then next we go to analysis, which is an essential role of an occupational therapist. Why we use activity analysis goes back to all of those assignments we had throughout school where we would break things down into their components. And then activity-focused analysis. So this really breaks it down. It goes very in-depth, which is very helpful. And then client-focused. And then we have adaptation. So the definition, parameters, goes down into activity demands, like the body functions, required actions and performance skills, the objects, and sequence and timing. And so these two kind of go back to the OTPF for me. So see how it all kind of ties together is very helpful to have it all in one place. This next one is evaluation of sensation in intervention for sensory dysfunction. So here we have your somatotopic arrangement, which includes the homunculus, which we learned in neuro that first semester, localization of touch, and how to test for localization of touch. Stereognosis, we got to do a couple of these tests in labs. So this kind of goes over that procedure, what stereognosis is, and then proprioception. Again, that definition, how to test for it, make sure that it's intact. Touch pressure, same thing, bunch of definitions, and then how you can test to see where your client's touch, like how intact it is, if it's accurate, if it's inaccurate. Then we have superficial sensation, which is a bigger section, which includes pain, temperature, and touch. So again, definition and then procedure, scoring. Temperature awareness, procedure, scoring, definitions, and then same with 2-point discrimination as well. And that's it for this section, and then one more for sensation, and then we're done with that one. So this one is, again, evaluation and intervention, just from a different chapter, so getting a bunch of different perspectives. and different information on all of these. So general approaches, a bunch of different disorders, which is very helpful. So it breaks it down into the disorder, the assessments, and the interventions, which is wonderful. This is a great little cheat sheet to have if you ever work with patients with visual dysfunctions. And then same thing for visuospatial perception disorders. Same thing for right-left discrimination dysfunction, tactile perception disorders, and motor perception disorders. So this is just a really great concept map. Very helpful information, very practical for using it in a clinic setting. All right, and then vision, I believe, is our last one. So we'll go to that first chapter, which is assessing abilities and capacities. So it kind of breaks it down into visual attention, different kinds of visual attention, and definitions of those. Another good chart. Models of functioning in vision, very important. Population and vision problems, you could see it from peds to geriatrics, so just kind of breaks that down in different levels of visual acuity. We're going to go down to visual field, breaks down what a visual field is, how you measure it, some common issues people have with that, oculomotor function, really great example picture of eye alignment. And then we're going to go back up to assessments. So this breaks it all down into the different areas that you might need to look at for vision. This next one is going to be optimizing vision and visual processing. So defines neglect, which we're all familiar with. Low vision, this is great because it has some interventions, different adaptations you can make, strategies, really helpful. And then this is more the diagnoses related to low vision, so I guess I kind of skipped one. So it just breaks down what they are, what causes it, different medical treatments, and then what OTs can do to help with those. So we looked at that. And then visual impairment as a result of neurological conditions. So this is, again, great because it has what the complications are and then interventions that you can use for these patients. So really well organized and will help with studying for the MVCOT, as well as a great little cheat sheet for when you're out in field work or actually working as an OTR. Again, we go into interventions. These are for oculomotor dysfunctions. Then unilateral neglect, and then more interventions. And then we have our last chapter, which is evaluation and treatment of visual dysfunctions following brain injury. So this is specific to brain injury, obviously. So this is looking at visual attention and scanning. So it has our definitions, our deficits, the areas where they have limitations, and then assessments and interventions. Pretty good list of interventions and a great chart to help you figure out which nerve may have been affected based on their visual impairments. Visual field, same thing, gives limitations, activities, assessments that you would use, and then intervention areas that you can do. Same for visual acuity. Has all of that lovely info. And then specifically, what OT can do for vision interventions, which I think is really important. Just to justify why OT is participating in this area, because it is a more uncommon one, or less thought of one that we would do. So good to have that justification for it and be able to know that for the test in case something like that were to come up in the questions. And then the role of vision and adaptation processing, which is also important because it shows how vision is tied to every other activity that you do. So it impacts all your occupations that you are involved in on a day-to-day basis. And then, I skipped this one earlier, this is same for oculomotor dysfunction. Gives a definition, interventions, and then deficits they may be experiencing. And that's it. All right, thank you.